A 6-year-old girl is brought to the physician with a fever and rash for 2 days. The rash is formed by patches of small papules and covers most of the patient's body, sparing the palms and soles. The patient's tongue and oral pharynx are also found to be erythematous. Which of the following is the most likely complication this patient may experience? Choice A, diastolic heart murmur with bounding peripheral pulses. Choice B, systolic heart murmur radiating to axilla. Choice C, systolic heart murmur increased with inspiration. Choice D, continuous machine-like murmur. Or choice E, myocardial infarction. I'll wait 5 seconds and answer your question. So this, of course, is scarlet fever. It's a group A streptococcus infection, strep pyogenes. Now, of course, the big thing when you think about scarlet fever is that you need to be able to differentiate it from Kawasaki disease, and I'll talk about that in a second. But, of course, this patient has pretty much all the symptoms, right? You got the buzzy, finding sandpaper-like rash, the strawberry tongue, and pharyngitis, which pushes it way more towards group A strep infection rather than Kawasaki disease. So of course, when we think strep pyogenes infection, we think of a lot of different conditions. You gotta know a lot about group A strep for step exam. So of course, there's pharyngitis, skin infections, and of course, you also think about the delayed antibody-mediated reactions, which is rheumatic heart disease. And this, of course, happens because of the M protein on group A strep exhibiting molecular mimicry. So when you create antibodies against that, the antibodies can also mistakenly damage your own tissue. In this case, the most common one being your mitral valve. And that can lead to either mitral prolapse, which is often described as a mid-systolic click, or more commonly, what they like to test is mitral regurg, which is choice B, systolic heart murmur radiating to the axilla. More specifically, it's a hollow systolic murmur, right? Now, of course, those of you who are all up to date with your rheumatic heart disease will also know that it can rarely affect the aortic valve as well. So, of course, we can look at choice A here, diastolic heart murmur with bounding peripheral pulses, referring to aortic regurgitation. So, like I just said, it is possible in rheumatic heart disease to get aortic pathology, but it's obviously not the best answer choice here. It's less likely. And of course, you can think of all kinds of other associations for aortic regurgitation: hypertension, aortic dissection, bicuspid aortic valves, and you can think of all kinds of inherited diseases, especially various connective tissue diseases like Marfan syndrome also increase the risk of stuff like aortic dissection and ultimately aortic regurgitation. And of course, there's also other associations like Turner syndrome. A lot we could talk about. But once again, keeping it to rheumatic heart disease, mitral valve most common, aortic valve can also happen. Choice C, systolic heart murmur increased with inspiration. So when you think heart murmurs increase with inspiration, that tends to be right-sided heart murmurs, as opposed to expiration, which would be more left-sided heart murmurs. So a systolic right-sided heart murmur would probably be either a tricuspid regurg or a pulmonic stenosis, neither of which really are related to rheumatic heart disease. Although it's probably worth noting, tricuspid regurg has a pretty strong association with pulmonary hypertension on USMLE, and sometimes resources like to talk about IV drug use and how that can cause right-sided infective endocarditis leading to tricuspid regurg. I've seen it come up a few times, but not as often as you might think, given how often resources like to talk about it, but still worth mentioning. Choice D, continuous machine-like murmur. This is PDA, patent ductus arteriosus. Not much to say here. I mean, a PDA is usually associated with either a premature infant or congenital rubella syndrome. I think those are the two big things you want to associate with PDA. And of course, you need to know the murmur description is super buzzy. Choice C, myocardial infarction. So, like I mentioned earlier, you want to be able to differentiate scarlet fever from Kawasaki disease. Kawasaki disease can cause MI in children. It's one of those rare instances where it can happen. So, of course, Kawasaki disease is a vasculitis, and they like making you differentiate it from scarlet fever on USMLE because it similarly presents with fever, rash, strawberry tongue. So, a couple ways you can differentiate. Usually in Kawasaki disease, the fever lasts longer. It's a prolonged fever. In Kawasaki disease, the rash can spread to the palms and soles. And the rash in Kawasaki disease is often found to be more polymorphic. It looks a little bit less consistent through the body. Kawasaki disease would also have stuff like cracked lips and conjunctival injection. And of course, in this question, I described something that sounds like a pharyngitis, which you wouldn't see in Kawasaki. So like I mentioned, Kawasaki can cause stuff like coronary artery aneurysms and myocardial infarction. And because of how severe the complications of Kawasaki disease can be, you also want to know it's one of the exceptions to giving aspirin to children. You usually don't give aspirin to children because you're afraid of Reye syndrome, but because of how severe Kawasaki disease can be, it's one of the few times we say it's worth the risk of giving aspirin to a child. So bring it back, I mean, this is just a question to make sure you know your heart murmurs, right? Now, by all means, if I wanted to make this question harder, I would have found some weird way of describing these murmurs. But USMLE does really like to repeat descriptions of different murmurs, like mid-systolic click is pretty much always mitral prolapse. Polysystolic radiant to axilla is mitral regurg. Diastolic with bounding pulses, that's aortic regurg. Continuous machine-like murmur, that's PDA. It is worth familiarizing yourself with these terms and descriptions that come up over and over. But you can also think about it kind of intuitively too, right? Because, for example, systolic heart murmur radiating to axilla being mitral regurg. If you think about the anatomy, it's your blood flowing backwards from your left ventricle into your left atrium. And if you think about the direction that's heading, that's kind of like superior and to the left. So that's where your armpit is. That's why it radiates to the axilla. All these descriptions can be broken down in a way where they actually make perfect sense when you think about it. And of course, like I said, you want to be able to differentiate scarlet fever from Kawasaki disease. Hope you found this video helpful. See you in the next one.